Hello guys, so today we shall be discussing another important topic from the protozoa, right? So that is Trichomonas vaginalis. So all of you know what is Trichomonas vaginalis, right? So Trichomonas vaginalis, basically what is this? Trichomonas vaginalis is a protozoa. Trichomonas vaginalis is a protozoa. So what does it cause basically? Why are you discussing? Because this is the most important topic regarding the protozoa which you need to know. So Trichomonas vaginalis is a protozoa, and this not only, now looking at the term vaginalis, don't think that it infects only females, but surprisingly Trichomonas vaginalis even affects males. At the same time it also affects the females. Right. So when it comes to males, what is the problem it is causing? When it comes to females, and what is the problem is it causing? When you look at the male, for example, if a male is affected with this Trichomonas vaginalis, so he gonna end up having a condition called as urethritis. Urethritis. In the same way, if a female is affected with this Trichomonas vaginalis, then she gonna end up having a problem called as vulvovaginitis. That is vulvovaginitis, right? So what are the problems, guys? One is urethritis, another one is vulvovaginitis. So which group of people are most commonly affected with this Trichomonas vaginalis? So if you ask me what are the risk factors, right? So risk factors, what are the basic risk factors of this Trichomonas vaginalis? So for example, the first risk factor is that if someone is hungry enough to have a new sexual partner in his life, new sexual partner. So people who tend to have new sexual partners, right? So today and after few years another sexual partner, after few years or after few months the next sexual partner. So in that cases the probability, the risk of getting this infection will be more. Or else if someone is really hungry enough to have multiple sexual partners, right? Multiple sexual partners. So this will be like a 9 to 5 job. So from 9 o'clock he'll start at one home and it starts rotating from one home to the other, to the third, to the fourth, to the fifth. So in such cases, those are having multiple sexual partners, so even they are at a higher risk of having this Trichomonas vaginalis. And lastly, those group of people who have unprotected sex. Unprotected sex. So these are the three most common causes, right, or the common risk factors for developing Trichomonas vaginalis. So can I tell all these are some sexually related risk factors? So can I tell that Trichomonas vaginalis is a sexually transmitted disease? Yes. Trichomonas vaginalis is a sexually transmitted disease. What is Trichomonas vaginalis? It is a sexually transmitted disease. Now, what is the basic pathogenesis which you need to know? Pathogenesis. What will be the basic pathogenesis? Pathogenesis, in the sense, there is nothing much pathogenesis to discuss, guys. But basically what happens is, for example, this is the vagina, right? So this is the uterus. Right. So let us say this is the uterus and here you got your vagina and all. So this bacteria basically it lodges in the vaginal region like this. So this protozoa will lodge in the vaginal region like this, and this protozoa will obviously it will multiply in number. So as it is multiplying, what does it do is it will destroy the surrounding tissue, or let us say it will cause inflammation of the surrounding tissue. So if it is causing in the vagina, you call it as vaginitis. If it is causing in the cervix, you call it as cervicitis, right? If it is causing in the uterus, you call it as endometritis, right? So this is the basic thing. So what is going to happen with this female is that, for example, if this female who is having who is affected with this Trichomonas vaginalis, and if there is vaginitis, severe vaginitis for this female. So if such female participates in any kind of coitus, any kind of sexual activity, so during coitus, right? So during coitus, what is going to happen? She'll have pain, severe pain, right? So this is called as dyspareunia. So this is called as dyspareunia, right? So what are the symptoms which basically they have? The first symptom is dyspareunia, which is also called as painful coitus. Dyspareunia called as painful coitus. The second important thing, what is the second important thing which the patient can have? The patient can have dysuria, because urine passes through the same opening. So if there is infection there, obviously there will be a burning sensation or inability to properly urinate. What will be the third important thing? The third important thing will be near the vagina there will be severe itching and burning, right? So you call it as vulvar itching and burning. Vulvar itching and burning. So these are the basic three symptoms, guys. These are the basic three symptoms which you encounter in case of Trichomonas vaginalis. So when I do any kind of physical examination, what are the things that I am going to find? For example, if I am doing a physical examination, right? So when I do a physical examination, so what are the things I am going to find is that there will be the color of the vagina will be a strawberry color, right? Strawberry colored vagina, right? The second important thing will be there will be malodorous green discharge. Malodorous green discharge. So what is the diagnosis which I do? How will I diagnose the case? The first diagnosis which I do is wet mount microscopy. Wet mount microscopy. This is the first diagnosis which I do, right? The second way through which I can diagnose is that I take a swab from the vaginal region, right? So when I run the culture, it will be positive for the bacteria. So there will be a positive swab test, right? So patient gonna have positive culture from urethral swab. Positive culture from the urethral swab. And finally, guys, what will be the treatment? What will be the treatment? The treatment will be metronidazole. Metronidazole. But if the patient is having some contraindications to metronidazole, right, in case some of the patients will be contraindicated to metronidazole, they are not supposed to use metronidazole because of some of other problems not related with this problem. So in such cases, you can switch to another drug called as tinidazole, right? So this is the end of the lecture. Thank you.